Good morning, everyone. Today we are here to discuss the topic myasthenia gravis. First, I am going to teach to you what is myasthenia gravis. Then I will explain about introduction and definition of myasthenia gravis. Then we will discuss what are the epidemiology of myasthenia gravis, etiology, pathology, classification of myasthenia gravis, clinical features, examination of myasthenia gravis, and complication of myasthenia gravis. And finally, I am going to share with you about what are the investigation and management of myasthenia gravis. First, the introduction of myasthenia gravis. Myasthenia gravis is a chronic autoimmune neuromuscular disease. Autoimmune disease, it's an autoimmune disease means our immune system act against us. Our immune system act against us and causing a neuromuscular disease. The name was originated from Greek and Latin, which literally means grave muscle weakness. It is caused by a breakdown in the normal communication between nerves and muscles that control and perform voluntary movements. Next, what is the definition of multiple sclerosis? It is an autoimmune disorder caused by circulating antibodies that block the acetylcholine receptors at the postsynaptic neuromuscular junction, resulting in fluctuating muscle weakness and fatigability. Epidemiology of myasthenia gravis. Prevalence of 1 in 7,500. It affects all age groups with peak incidence between 20 and 40 years of age. Women are affected more frequently than men, with an approximately ratio of women is to men is equal to 3 is to 2. Familial occurrence is rare. Next, the etiology of myasthenia gravis. Antibodies against tyrosine kinase. Tyrosine kinase is a muscle specific receptor. Thymus gland pathology like thymomas, that is tumors of thymus gland. Next, the genetic factors. Next, the pathology of myasthenia gravis. Myasthenia gravis is caused by impaired transmission of nerve impulse to muscle. The antibodies block, alter, or destroy the receptors for acetylcholine at the neuromuscular junction. The amount of acetylcholine release per impulse normally declines on repeated activity, which is known as presynaptic rundown. This prevents the muscle contraction. Next, the classification of myasthenia gravis. The most widely accepted classification of myasthenia gravis is the Myasthenia Gravis Foundation of America Clinical Classification. Class 1, any eye muscle weakness, possible ptosis, no other evidence of muscle weakness elsewhere. Class 2, eye muscle weakness of any severity, mild weakness of other muscles. Class 2A, predominantly limb or axial muscles. Class 2B, predominantly bulbar and or respiratory muscles. Class 3, eye muscle weakness of any severity, moderate weakness of other muscles. Class 3A, predominantly limb or axial muscles. Class 3B, predominantly bulbar and or respiratory muscles. Class 4, eye muscle weakness of any severity, severe weakness of other muscles. Class 4A, predominantly limb or axial muscles. Class 4B, predominantly bulbar and or respiratory muscles, can also include feeding tube without intubation. Class 5, intubation needed to maintain airways. Then the clinical features of myasthenia gravis. The initial symptoms of myasthenia gravis are difficulty in speaking, dysarthria, difficulty in swallowing, dysphagia, drooping of eyelids, ptosis, nasal sound speech, fatigability, development of progressive weakness in the muscles of arms, trunk, limbs within a year of onset. The muscles will become progressively weaker while activity and recover at rest. Muscles responsible for breathing are also affected. Unstable or waddling gait, expressionless face. Next, the examinations of myasthenia gravis. Muscle fatigability can be tested by many ways. Muscle fatigability is the main symptom of myasthenia gravis. So, the muscle fatigability can be tested by many ways. First one, looking upward and sideward for 30 seconds. 2. Ptosis and diplopia. Looking at the feet while lying on the back for 60 seconds. Next, keeping the arms stretched forward for 60 seconds. Next, 10 deep knee bends. Walking 30 steps on both the toes and heels. Next, the 5 sit-ups. Next, lying down and sitting up completely. And main examination of myasthenia gravis is peak sign. After what is peak sign? After complete initial apposition of the lid margins, they quickly within 30 seconds start to separate and the sclera starts to show drying response. This is peak sign. Next, the complication of myasthenia gravis. The main complication of myasthenia gravis is the myasthenic crisis. It is a medical emergency that involves the respiratory muscle paralysis, and other complication may include choking, pneumonia, and the foot aspiration. Next, the investigation of myasthenia gravis, blood test, serum antibodies sensitivity to acetylcholine. Next, the EMG studies, chest X-ray, pulmonary function test. These are the investigations of myasthenia gravis. Next, the management. Medical management, administration of cholinesterase inhibitors, example neostigmine. Next one, immunosuppressive drugs, example prednisolone, thymectomy. These are the management of myasthenia gravis. These are about the myasthenia gravis. Thank you.